History of borderline personality disorder, BPD, origins and development of the disorder. Borderline personality disorder, BPD, is a complex and often misunderstood mental health condition, and its historical evolution offers insight into how psychiatric professionals have come to understand the disorder and how perceptions of it have changed over time. In this episode of the Borderline Personality Disorder, BPD, podcast, we will delve into the origins of BPD, the key moments in its development, and how it has been conceptualized in both psychiatric and social contexts. Understanding the history of BPD not only sheds light on the disorder itself but also reveals how stigma and treatment approaches have evolved. Early concepts of personality disorders. The concept of personality disorders, in general, has deep roots in the history of psychiatry. Early understandings of mental illness were often framed in terms of vague and sometimes philosophical notions of character or temperament. It wasn't until the 19th and 20th centuries that personality disorders began to be formally recognized as distinct clinical categories, separate from psychosis and other forms of mental illness. In the early 20th century, psychoanalysts such as Sigmund Freud began developing theories about the structure of the psyche and the role of childhood experiences in shaping personality. Freud's work laid the foundation for understanding how certain patterns of behavior, thought, and emotion could be tied to internal psychological conflicts, though these ideas were still somewhat abstract and unscientific by today's standards. Emergence of borderline personality disorder, BPD, as a concept. The term borderline and borderline personality disorder was first used by Adolf Stern in 1938, who identified individuals whose symptoms seemed to fall on the border between neurosis and psychosis. Stern noticed that some patients exhibited features that were neither fully psychotic nor completely neurotic, often displaying emotional instability and difficulty maintaining consistent self-images, without the extreme delusions or hallucinations associated with psychosis. This early understanding of the disorder placed it in a kind of no man's land in terms of psychiatric diagnosis, often leaving clinicians puzzled about how to categorize these patients. In the 1940s and 1950s, the concept of borderline states, or borderline conditions, began to gain more prominence in psychoanalytic circles. Psychiatrists such as John Gunderson and Marsha Linehan would later build on these ideas, identifying and codifying the condition as a distinct personality disorder. The role of psychoanalysis in defining BPD. In the 1940s and 1950s, psychoanalytic theory heavily influenced the understanding of many mental health conditions, including BPD. Psychologists began to theorize that individuals with BPD suffered from an unresolved conflict in the development of their ego or self-identity, often related to early childhood trauma or neglect. This psychoanalytic model suggested that the disorder stemmed from an inability to manage emotions, particularly in the context of interpersonal relationships. The focus was largely on childhood experiences, especially those that involved neglect or abuse. Pioneers in psychoanalytic theory, including Otto Kernberg, described patients with BPD as having unstable self-esteem and alternating between idealizing and devaluing others. These patients were thought to experience difficulty integrating conflicting emotions and views about themselves and others, leading to the cyclical, extreme patterns of emotional responses that are characteristic of BPD. While psychoanalysis offered an influential framework, this perspective also faced criticisms for being overly focused on theory and not sufficiently grounded in empirical research or practical treatment approaches. The DSM and the formal recognition of BPD. The turning point for BPD came in the 1980s, when the Diagnostic and Statistical Manual of Mental Disorders, 3rd edition, DSM-3, included borderline personality disorder as a formal diagnosis. This marked the first time that BPD was officially recognized as a distinct personality disorder within the psychiatric community. The inclusion of BPD in the DSM-3 provided clearer diagnostic criteria, helping to distinguish it from other psychiatric conditions such as schizophrenia and depression. The criteria emphasized patterns of instability in relationships, self-image, and emotional regulation, as well as impulsive behavior. This formalization helped to establish BPD as a legitimate diagnosis, paving the way for research into its causes, treatment, and management. The DSM-3 criteria for BPD included symptoms such as a fear of abandonment, unstable interpersonal relationships, impulsive behaviors, and emotional instability. This diagnostic framework has evolved over time, but it remains largely consistent in its focus on emotional regulation, self-image issues, and interpersonal difficulties. Advances in treatment and research. As BPD became more widely recognized, treatment strategies began to evolve. One of the most significant advances in the treatment of BPD was the development of dialectical behavior therapy, DBT, by Marcia Linehan in the late 1980s. DBT was developed specifically for individuals with BPD, focusing on helping them manage intense emotions and develop healthier coping mechanisms. DBT incorporates aspects of cognitive behavioral therapy, CBT, mindfulness, and acceptance-based strategies, and has become one of the most effective treatments for BPD. Over the years, research into the neurobiological underpinnings of BPD has also gained traction. Studies have shown that individuals with BPD may have differences in brain regions involved in emotion regulation, such as the amygdala and prefrontal cortex. These insights have opened the door for more targeted treatments, including medications to manage symptoms of mood instability and impulsivity, although psychotherapy remains the primary treatment. The stigma in changing perceptions of BPD. Despite the recognition of BPD as a legitimate disorder, individuals with BPD still face significant stigma. Historically, the disorder was viewed as difficult to treat, and patients were often labeled as manipulative or dramatic, which reinforced negative stereotypes. The media and cultural portrayals have contributed to these misconceptions, often depicting individuals with BPD as unstable or dangerous. However, in recent years, there has been a push toward greater understanding and compassion for those living with BPD. Mental health professionals, advocates, and individuals with BPD themselves have worked to challenge the stigma and promote a more nuanced understanding of the disorder. Efforts to raise awareness about BPD have focused on highlighting the importance of empathy and support, as well as the effectiveness of modern treatments. The future of BPD understanding. The future of BPD research and treatment is promising. Continued efforts to explore the genetic and neurobiological factors contributing to the disorder may lead to more precise diagnostic tools and treatments. Furthermore, as public awareness grows and the stigma surrounding BPD begins to diminish, more individuals may feel empowered to seek help, leading to better outcomes for those affected by the disorder. In the coming years, we may see even more innovative therapies that address the emotional and psychological needs of those living with BPD. As our understanding of the disorder deepens, the goal is to move beyond stigma and misunderstanding, and to foster a society that recognizes BPD as a treatable condition that requires compassion, care, and support. Conclusion. In this episode, we've traced the history of borderline personality disorder, from its early conceptualization as a borderline state to its formal recognition as a distinct personality disorder in the DSM. Over time, BPD has evolved from a misunderstood and stigmatized diagnosis into a condition that is increasingly recognized for its complexity and treatability. As research advances and treatment modalities improve, there is hope that those affected by BPD can lead stable, fulfilling lives with the right care and support. Stay tuned for more episodes as we continue to explore the history, symptoms, causes, and treatments of borderline personality disorder.